You have seen individuals who have had ulcers on the legs that have been persistent for quite some time. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Derito. Today our talk will be based on chronic leg ulcers. Chronic leg ulcers are ulcers that have been persistent on the lower part of the legs for more than 6 weeks. The ulcers can be caused due to various causes, including venous diseases. You can have arterial causes. You can also have pressure ulcers, and you can also have diabetic foot ulcers. Arterial ulcers are ulcers that develop especially on the extremities of the lower limbs due to insufficient blood supply. Arteries are the vessels that take blood from the heart to the rest of the body, and for various reasons you can have conditions that cause inadequate blood supply to the legs. Like if someone has a blockage of the blood vessels, this could be due to conditions like diabetes, hypertension, smoking. So the blood supply to the extremities is cut off. They will usually start on the toes and they progressively develop upwards. We have venous ulcers, which result from pooling of blood on the lower limbs. Veins are the blood vessels that take blood from the legs back to the heart. If there is incompetence of the valves, then you have pooling of the blood, causing swelling, and there will be thickening of the skin, and finally there will be opening up of the continuity of the skin, causing persistent ulcers on the legs. Diabetic foot ulcers are ulcers that develop on the feet due to poor nerve supply on the extremities, which is a complication of diabetes, leading to loss of the continuity of the skin and opening up of wounds, which can persist for some time, because the individuals with the problem with the nerves is called a neuropathy. They have lost their sensation, and this can lead to persistent wounds on the legs. Then you have pressure ulcers, which are ulcers that develop on the lower legs, especially due to putting the feet on the same position for long periods. This happens in individuals who have lost their sensation for various nerve problems, like someone with spinal injuries, patients with stroke, patients with other conditions that impair their mobility, and then they get wounds due to persistent pressure on the legs. So when you have individuals who have venous ulcers, there is persistent pooling of blood on the lower limbs, and this leads to superficial ulcers, which are persistently bleeding, and the ulcers tend to be more painful. So for the management, you need to do blood tests to rule out the possibility of infection, rule out the presence of other diseases, and also doing cultures to be able to diagnose what are the most likely organisms that are causing the ulcers. So for arterial ulcers, then the most important thing in the treatment and management of these ulcers is trying to have revascularization. This happens because the arteries are blocking up, and you may have surgical need for revascularization. Of course, if they are wound, they need to be debrided and all the dead tissues removed, and the establishment of good blood supply. Of course, on the behavioral part of it, those who are smoking, especially the heavy smokers, then it is very necessary for them to stop smoking. For people with diabetes and hypertension, it's good to adopt healthy lifestyles and also have the conditions managed. For the venous ulcers, this happen due to loss of the functioning of the valves in the veins, and this causes pooling of fluid in the lower limbs. There is need to have the legs elevated so that you have drainage of the fluid that occupies the lower limbs, cleaning of the wounds and dressing, and also applying compressive stocking so that there is assistance to help to pull back the fluid that is accumulating on the lower limbs, and also good feet care. So if individuals have developed deep venous thrombosis causing venous problem, then they need treatment for the DVT. So there should be use of elevation of the limbs, putting the feet under a pillow, especially when sleeping, and also elevating the limb when they are in sitting position. Exercises help a lot, especially moving the joints and the muscles, so that this can help to try to pull the fluid back into the circulation system, reducing the swelling. So leg ulcers are a common problem. They can be caused by either venous problem, arterial problem, or due to diabetes or pressure issues. And this can be taken care of, and the treatment is dependent on what is the cause of the leg ulcer. Thank you for listening. If you like our talks, kindly subscribe to our YouTube channel or follow us on Facebook or Twitter, and help us reach out to more people so that we can be able to take care of our health together. Thank you for listening.